How are you? I'm Dr. Fernando Lemos, a colorectal surgeon from Rio Grande do Sul, Brazil, specialist in diseases of the intestine, rectum, and anus. In this video, I want to talk about anal sex or coital sex. I want to clarify some topics and bring some clinical cases here that will provide great insights and explanations for you who are part of our team here on our channel called Planet Intestine. Before starting this video, I would like to extend a special invitation. We have a completely new project, some news that we will soon bring to the public. But initially, I want to invite all of you who are watching this video to also share this video. We have created a Telegram group. Some people still don't know what Telegram is. Telegram is like WhatsApp. You just download Telegram as an app on your phone. Regardless of your phone's brand, go to the App Store and download Telegram. After you download it, you'll click on a link that will be below this video in the video description down here. Then you'll be added to this Planet Intestine Telegram group. It's a private, exclusive group where I share some information that I don't share here on YouTube, Facebook, or Instagram. It's something a bit more private, a bit more intimate for people who want to have a closer contact with the specialist, okay? Download Telegram, click on the link below, and you'll join our Telegram group, okay? I also invite those who are not subscribed to the channel to subscribe, be part of our team. Click where it says subscribe here. It's completely free. And if you want, like it. If you enjoy the video, give it a like. This is very important for our ranking here on YouTube, so we can continue doing this work that we've been doing here. Before starting to talk about anal sex, I want to remind you that we already have 2 videos here on the channel. Anal Sex Part 1, Myths and Truths, and Anal Sex Part 2, which is Myths and Truths. I would also like to clarify the following. I'm not here to say whether I think it's right or wrong to have anal sex. I'm not here to say if your belief allows it or not, because as a specialist, as a colorectal surgeon, I'm the one who should talk about this subject. There's a lot in the media, a lot on social networks, a lot on television, a lot in magazines that are not explained by specialists. And I'm the one who should address these topics. So, what I said in videos 1 and 2, I won't bring all that information again here. I invite you to watch them. I want to bring here, folks, in a very curious and exclusive way. I think there's no video clearly about this on all of YouTube. I think I've never seen it, especially a specialist talking about 3 clinical cases. And by chance, these 3 clinical cases happened this week. We are on Wednesday. I'm here in the surgical block of my city. We're just finishing the 7th procedure. Let's go. First clinical case. A patient came to my office with a complaint of recurrent urinary tract infection. That is, a young man in his 40s with urinary infections, one after the other. And several urine tests with some small infections. Then he took antibiotics. He came and told me 2 things. I've already consulted with 5 doctors. He's a patient from another city. I've already used about 10 types of antibiotics. Did you hear that right? 10 types of antibiotics. And I never get better, Dr. Fernando Lemos. And I came here. I want to hear your opinion, even though you're a colorectal surgeon and not a urologist. Very well. First detail. It's very common for women to have urinary infections because the vaginal area is close to the anal area, so this contamination is much simpler to happen. But for men, because of the urethra that is inside the penile area, it's long, so it's harder for an infection to reach the bladder to cause an infection. So always with urinary infections in men, we consider something that needs to be investigated and something much more serious than urinary infections in women. And I started talking to him, and I came and said to him, I'm going to touch on a very intimate subject, but I have to ask you, and this is me. He's married? He said, do you have anal sex with your wife? He said, look, Dr. Fernando Lemos, I have a lot of anal sex with my wife. He even brought me a fact. He said, look, Of the sexual relations we have in a month, half of them are anal sex, and not vaginal sex. Very well. And then a little light went on for me, and I made a request. I asked for a urine test with culture and asked to do a worm test in the urine. Even the laboratory in his city, the city of Mediporte, the biochemist contacted me and thought I had requested it wrong, because usually the parasitological test we ask for feces, right? And I said, no, I'm not wrong. No, I want a parasitological test in the urine. And this patient came to me on Monday, brought me the test, and guess the surprise of the lab technician and even more of the patient. Do you know what his urinary infection came from? He had already had an ultrasound done. There was no recurrent infection. Doctors had already requested an ultrasound to see if there was any polyp bladder, any stone, any foreign body that could have caused the urinary infection. And do you know what came? A urinary parasitosis. That is, worms in the urinary tract. And they managed to isolate the worm Ancylostoma duodenale, which I know doesn't matter to you. That is, it's a worm infection. Then I came to him and said, you don't use a condom for anal sex, coital sex? He said, no, doctor, it's my wife. We've been married for so long. I said, well, there's the problem. And here's the tip from this clinical case. Don't forget that the penis has a small opening at the tip that we call the urethra, the rectum. And the anal canal is the most contaminated place in the body. The further from the mouth, the more contaminated. That is, the bladder, stomach is more contaminated than the mouth. The small intestine is more contaminated than the stomach. The large intestine, the colon, is more contaminated than the small intestine, and the rectum carries all the present contamination to the rectum. And when there's anal sex, even more so repetitively, he acquired a worm infection through the urethra, and I went to investigate, and he and his wife hadn't taken deworming medication for about 10 years. And you know, those who are part of our Planet Intestine channel know that once a year we are obliged to do it. There's a video you have to watch, which is a very interesting practical video the whole family has to watch, where I talk about Giardia. Watch this video about Giardia here on our Planet Intestine channel, which is very, very enlightening, okay? Treatment for him. Dewormer. I'll just have to use a high-dose dewormer. I used 2 types of dewormers for him, and I told him, don't worry. Now this urinary problem of yours will be eradicated. And from today on, condom. Every time you have anal sex, something curious, but something extremely interesting. Second case. This week I operated on a woman with an anal sphincter laceration. After anal sex, it cut her anal sphincter. There was a laceration. We have the sphincter. It's a ring. We have the external and the internal. There are 2 that we have there. She tore it. She was in extensive pain and bleeding. We performed her surgery with some urgency to do the sphincteroplasty, the correction of her anal sphincter. And then you might say, doctor, does all anal sex cause this? Obviously not. What specifically happened in the case of this female patient? Let's go. First detail, she didn't do proper lubrication. In one of the videos, I've already explained that anal sex must have intense lubrication with water-based lubricant. Don't use lubricant with anesthetic. Don't use anesthetic ointment. That's not interesting. Water-based lubricant. There are several water-based lubricants on the market in the pharmacy to be bought, and the lubrication must be done abundantly on the anal part and abundantly on the penile part. It's no use lubricating just the penis or just the anus. You have to lubricate both parts. And her second big mistake, she started her anal sex in a totally inappropriate position. She started in the genitopectoral position. For those who don't know, the pectoral is the kneeling position, and actually one of the great videos I explained, which I say this is something only a specialist can explain. The rectum is called rectum, but it's not straight, it's curved. The correct position to start anal sex is lying on the side. A tip I give to my patients who come to me for information about this: the tip of the penis has to enter towards the navel of the person receiving, the passive receiving the anal sex. If it happens to do the genitopectoral position, kneeling, the more popular one, which is on all fours, imagine the following. The navel is down here, the penis is directly here. It will enter like this. It's not anatomical, so the correct position to start anal sex is lying on the side, so the penis goes towards the navel area. So there were two serious mistakes without lubrication and without this guidance that almost no one has on how to start anal sex.
Dr. Fernando Lemos, can you change the position later?
You can, but the start has to be like this, which is precisely so as not to tear the rectum inappropriately, okay? And the third case, to finish, a very interesting case also for women, is a patient who has already had surgery with me for an intestinal problem, and she went for a routine exam with me, a video colonoscopy, and she complained that she had a recurrent vaginal discharge. She had already gone to several gynecologists, had been told she had colpitis, inflammation of the cervix, vaginitis. Another said she even had salpingitis, which is an infection in the tubes. Repetition. I can't stand using so much vaginal cream, so much secnidazole, and I'm not getting better. I'm saying, what is this? You're not a gynecologist. And I went to ask her a little question. When it's recurrent, I said, come here. Do you have anal sex with your husband? Yes, I do. And does it eventually happen that you have anal sex and then have vaginal sex? And I said, yes, that happens. Sometimes it happens, yes. I said, there's the problem. It can never happen to have anal sex and then move to vaginal sex. Regardless of whether you're using a condom, you have to remove the condom. If you're going to make a change, people have to have vaginal sex first, and then anal sex. You can never bring contamination from the anal area to the vaginal area. It was also my report. Since I'm married, we don't use condoms. So we had anal sex and then had vaginal sex. It's extreme contamination. And there's the problem with that. I'm going to give you a new treatment for that and never do that again. The order can't be that under any circumstances. 3 situations with great lessons. The first is a man with recurrent infection. For not using a condom in anal sex, an extensive laceration that required surgery for not lubricating well, for doing the wrong position at the start of anal sex. And the third, a recurrent vaginal discharge for having anal sex first and bringing contamination to the vaginal area. It's an intimate video, full of taboos, but it has to be addressed with a colorectal surgeon. Don't forget to join our Planet Intestine group on Telegram. Below in the video description, it will be there for you to click and join. But first you have to download Telegram. Those who don't follow us yet on Instagram are dur.fernandolemos, or on Facebook it's Planet Intestine. And those who are not subscribed to the channel, subscribe. And until next time.